Hello.
Hi, how are you?
Good. How are you?
Good, thanks.
Okay, so we are back with Amberly Rowland, nutritionist. She works with cancer people in cancer recovery, specifically, and women's health. So she has been through her own journey of surviving cancer, and her passion is in the world of nutrition. And so I'm super thankful to have you here today. Super thankful to dive in a little bit deeper about the ketogenic diet. So last time we talked about just the basics, went over kind of the outline of it, the ABCs of it. And so today I really want to, which I think is a really important topic, dive into who should do this, who shouldn't do it, and what are some of the health risks and side effects people are seeing with the ketogenic diet. So let's dive into who this is for, really.
Sure. So I think a lot of people are doing the ketogenic diet for weight loss, and that's fine. However, I really encourage anybody considering this diet to talk to their doctor or nutritionist because it does have some risks involved. Okay, so for instance, somebody that is prone to kidney stones, this diet is high in oxalates. So you are going to want to be really mindful, and I've actually seen it in practice. I've seen people get kidney stones from this diet.
Yeah,
there are people that say it doesn't cause it, and I agree, it doesn't cause it, but it can be a side effect. For those that are doing it for cancer treatment, and there's so much research coming out that shows its efficacy in cancer treatment, or its integrative approach to it. If you have an abdominal tumor, it's contraindicated for that as well. So if you have any mets to the abdominal cavity, that area, you should stay away from this diet. Those with high cholesterol, we see in studies that it does increase your cholesterol in the beginning, and then cholesterol actually goes down. So I'm not saying those with high cholesterol shouldn't do it, but they should definitely be tightly monitored by their doctor, just in case, Same with gallbladder issues. The body adapts, but if you've had your gallbladder removed, you're going to want to be monitored by a doctor or nutritionist. So those are just some of the people that should be really mindful before approaching this diet. Of course, there are others too, and that's why it's really important to talk to your healthcare team.
Cool. So I was actually talking to a friend today, and she mentioned how she's following a ketogenic diet of sorts. And she was noticing how she's really breaking out. She's having trouble with her skin. So are there certain side effects as far as skin or digestion or hormones that come along with this?
Yes. So you're really tweaking your macronutrients here, and your body is going to have an adjustment phase. So a lot of people have something called the Keto Flu. It usually lasts about 1 to 2 weeks where they just feel really yucky. Sometimes they get diarrhea. They just feel like they have the flu. So a good way to avoid this is to get enough sodium and to also take magnesium, which I feel like everybody should be taking anyway. Our food is so denatured. It's good to have a magnesium supplement at night because it helps your muscles relax. So that's a tangent. But so those are a couple of things that you can do to help avoid that. As far as the skin is concerned, you are making more sebum in your cells as a result of the high-fat diet. So initially, you could definitely see some acne. And it can also theoretically cause some inflammation, so you might have some rashes. I've seen that too. So that's why it's really important to work with somebody so that you can have your diet monitored and that a nutritionist or doctor or whatever can help tweak those things to help resolve those issues.
Okay, cool. I thought it was really cool how you mentioned with the kidney stones that it doesn't necessarily cause it and it's a side effect. And I really appreciate you as a professional not being, I think some people can get so black and white in things of like, yes, it causes it, no, it doesn't. And then, we get in these kind of like wars of like, is it right or wrong, instead of going to exactly what you said. And it's not always causing things, but there's side effects. There's a lot of gray area. And so there's a really strong area, an important area, I guess, for people doing these to work with someone. And I think often, I know as a fitness professional, people try, like I did too, people try to do things on our own. And there's just so much more power to linking up with someone, even if it's just to get some insight in the beginning and checking in here and there, to make sure your body's functioning. I think there's a lot of power, and it will go further in the long run. So I appreciate you as a practitioner and expert, as a nutritionist, just sharing that side of things.
Yeah, absolutely.
So yeah. Cool. Okay. Well, that is what we have for today. So we will be back again, and Amberly will be sharing just how to do this ketogenic diet the right way, the way to get the most success out of it. So stay tuned, and we will be back with that. Thank you, Amberly.
Thank you. Bye.
Bye.